Welcome to our podcast, The Better You Are, The Better You Are. Whether it is physically, mentally, or spiritually, when you know better, you can do better. And when you do better, you'll be better. On this podcast, we share knowledge, expertise, opinions, and experiences. All things that can help you to change the game. By the time we're done, it's hard for you not to be encouraged. So join us. The better you are, the better you are.
Okay, we're excited to be back here today. We have Reverend Hazel Owens, who is an associate pastor at Common Ground Christian Church, Midtown, and is a licensed marriage and family therapist associate and owner of Owens Counseling and Consulting Services, LLC, integrating the worlds of faith, culture, and therapy. She has a master's in human resource management from Indiana Wesleyan University. And in 2016, Hazel took a leap of faith and pursued her purpose and calling to full-time ministry that includes integrating ideals of faith and therapy. This faith leap led her to dual degrees at Christian Theological Seminary, a master's of divinity, and a master's in marriage and family therapy. We also are blessed to have Dr. Glenda Rawls, who is an associate professor of counselor education and unit director at Western Michigan University. She earned her doctorate in counselor education from Western Michigan University in 2008 and has been a nationally certified counselor and licensed professional counselor in the state of Michigan since 2007. In addition to training future master's and doctoral level therapists, she also has a decade of clinical practice and supervision experience. So welcome back, ladies. So excited to be back and talking with you again. Last time we talked about Caroline Mays and her story and her experiences in high school and college. She talked about suicide threats. There was a racial component. And Hazel, we were going to talk about racial trauma. And that's where I'd like to pick up today. So what would you like to share with us regarding that history and that experience?
Well, I think the thing is that recognizing that racial trauma is a form of trauma, right? I think it's fair to say that our DSM-5 does not have a code for racialized trauma. Oftentimes the symptoms and experiences can be masked as PTSD or some other sort of mental illness. And so we have to be very careful when we are diagnosing and not paying attention to how the ills of racism has impacted people of color, right? And so it is essentially just the cumulative effect of racism in this country, racialized experiences, including like microaggressions and stereotypes and other biases that gets projected and imposed upon Black and Brown folks over time that can be traumatic and has oftentimes an impact on their physical health. So I could have a client, for example, that let's just say is a works 9 to 5, works in, let's just say, an organization that is predominantly white. There's already those internalized thoughts and pressures that are there, right? But they're dealing with signs of depression or maybe anxiety or what have you. And the more that we're talking, I'm realizing that there's aspects with work that is even more stressful that kind of exasperate these things. And then the more we continue to talk, I find out that, oh, wait, you're undergoing lots of microaggressions day in and day out in that space. And so there's this level of anxiety that tends to build up, or guardedness, right, while you're there, and it gets trapped and it gets stored, and there's no place to release or examine it, right? And so, but because we're so conditioned to these spaces and existing in these spaces, even Black and Brown folks won't even recognize how racism impacts us or how we, within ourselves. And so many of my clients will come in and can point to aches and pains in their bodies before they can even examine some of the invisible wounds that are happening. And so I'm not saying that stress and PTSD and depression and anxiety is not a thing. However, I do tend to examine how does racism or the effects of racism perpetuate that or exasperate those symptoms.
Yeah, it's sort of like an intersectionality of all those things. Particularly, I deal with women and preterm labor and complications of pregnancy that I think are compounded regardless of your socioeconomic status and health, that we're still at increased risk. And I think it's exactly, and evidence suggests it's exactly related to those things. What thoughts do you have on that?
Yeah, it's just building on what Hazel mentioned. She talked about a term called racial microaggressions. So wanting to talk a little bit about that and what it really means. Racial microaggressions are the everyday slights that are related to oppressed groups with regard to being seen, not seen, invisible. Oh, I don't see race, I don't see color, or, oh, we missed you on the list again. These are micro invalidations to actual micro assaults, right? Where someone is called the N-word or called a word that is associated with negative aspect of their racial identity. And when you, as Hazel mentioned, when you have to deal with this day in, day out, you also have to understand the cumulative effect that those kinds of things have. And just as Hazel mentioned, we sometimes, as people of color, don't recognize how those things really affect our living, really affect our wellness, and really affect our health. And we also know that there is a connection between mental health and physical health. And so, as Hazel mentioned, we're talking about higher blood pressure rates, we're talking about hypertension, we're talking about certain groups that some of these inequity and health disparities are really a direct relationship to having to deal with and live in a very racialized society. And so I agree with Hazel that oftentimes we're not, as people of color, not looking at the connection between our mental health, our physical health, and the racial environment that we live in, work in. And that includes school environments, college, K through 12, work environments. I have colleagues that no matter what environment, whether it's education, business, healthcare, there's a parallel, there has been a parallel in talking about how many people of color, despite the industry, may still experience certain levels of racism. And so we can't underscore enough of the connection sometimes between how we're feeling. And as Hazel was mentioning, sometimes the role of a therapist is to get to the heart of what's happening and to look at context in addition to what some of the issues that you're struggling with. And so it is not uncommon that a therapist might ask some questions about how things are going and what's happening to find those connections, to understand what is undergirding all of this. And for people of color, sometimes we don't often make that connection between our overall wellness and our overall feelings and how all of that is connected to the everyday incidents that we experience in the grocery store, at the bank, at the movie theater, how those things really affect us over time.
I give lectures on implicit bias in maternal health care and healthcare. And lately I've been showing these two videos. One video is of a Black girl and a white girl. They're both 6 years old. The Black girl walks up, stands in the corner of a busy intersection. They both have on white T-shirts, blue jeans, white shoes. They're 6 years old. The Black girl walks up there. People just pass her by. They don't recognize her. They don't see her. The white girl walks up there and stands, and people stop. Do you need help? What's going on? And she's paid attention, as you pointed out, ignored, not seen. The second video is of a gymnastic competition. And there's probably about 12 young girls, all white except one Black girl. And they go by, they give everybody a medal, and the person misses the girl and keeps on going. There's a person there taking pictures. There's other people. There's thousands of people around. and they just didn't give the Black girl a medal. The person handing them out said, I didn't see her. I didn't recognize her. I just missed her. I'm so sorry. And I think that I said, well, not only did you miss her, the person taking the pictures missed her. The other people in line missed her. Nobody said, hey, wait a minute, you didn't give her one, And so those things that start at a young age and build up for women and men can, as you point out, create issues of hypertension and obesity and mental stress that you don't even recognize. And so I want other people to recognize those things are happening, which is why I show the videos. But then you can get to things like, I deal in medicine and residents, and you say, well, I think this was not fair. And then they gaslight you and say, oh, no, it wasn't. You're being a little too sensitive. Oh, they didn't mean anything by that. I had a prime example of a microaggression when I walked into a hospital that, this was in the last 4 or 5 years. I walked in and somebody told me, when you go there, you have to try the hot chocolate in the doctor's lounge. So I walk in a suit, red suit, walking in. And I don't know if we're still on. I've lost my video.
We still see you.
Okay, there I am. So, and this older white woman walks up to me. She's a volunteer, very pleasant, very nice, and says, can I help you? And I said, well, actually, you can. I'm looking for the doctor's lounge. And I thought I knew where it was. I didn't really need her help, but she offered it to me. And she said, oh, well, the doctor's lounge are only for doctors. And I thought, and I just looked at her and I said, those type of things are aggravating. I told my friends that, they were clearly more upset than, did you tell her this? Did you tell her that? I just looked at her and I said, now I'd put my arm around and say, so tell me, what about the way I look makes you think I'm not a doctor? Or what does it matter? Maybe I'm supposed to meet my husband there. Maybe who are you to interject where I should be going? But anyway, I looked at her and she said, are you a doctor? Oh, yes, I am. And thank you. I don't need your help. But those kind of things are aggravating, as you point out. And it's those kind of incidents that unfortunately happen to people of color from preschool on up. And as you point out, Hazel, in my mind, I mean, it's enlightening to me. You don't necessarily recognize that's what you're frustrated and irritated about, or when that happens again. And how I was sitting at a function with 6 other women, and they were clearly upset by it. Clearly, it touched a nerve in them. And so I don't know if you have any.
Well, I think part of it is, I think for some of us, we get so numb to it, right?
Yeah.
And that, especially depending on how we've been conditioned in some ways to be appropriate in certain settings, in certain spaces. Right. And so we'll let moments like that just kind of, passively just go by us, or maybe we're exhausted.
Right.
I know there are times where I just don't have the mental capacity or the energy to address every micro or macroaggression that comes my way. When it happens I do think that many of us get a little numb to it. It's almost like we expect it to happen. And then we brush it off, but we don't really deal with the emotions that come. And the reason for that is because we don't have the privilege to. Let's just be real. In that moment, you don't have the privilege to pause and say, hey, you know what? I'm feeling a little frustrated, or I'm feeling a little agitated that you would make this assumption, blah, 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 blah. You trying to get to the doctor's lounge to get your coffee and do whatever you got to do.
Yeah, I got a busy day. Yeah.
And so you got things. So we don't always have the privilege to address every insult that comes our way. But then what happens is we don't go back. And so because we deal with it so much day in and day out, we become until we can't take it anymore. So then you tell your girlfriends about it or your colleagues about it, and they can hold the anger for you because they have the capacity in that moment to do it. And then that should be a signal for you to, okay, well, do I feel that way? And if I do, then how do I go and soothe that, right? So that I can deal with that stress, deal with that emotion, whatever the case may be. But I think we experience it so much in our lifetime in so many different spheres. I mean, Dr. Glenda said it best, like, the grocery store, the office, school, like is everywhere we go, right? And so yeah, I do think that there are times where either we just don't have the capacity or energy to address every insult, or a combination of that. And okay, I've just dealt with this already like 3 times this week, and and it's just what comes with Tori, right? And so almost like I'm expecting for this to happen when I'm in certain spaces. I am one of few, or the only, or whatever the case may be. And so we have learned to appropriate ourselves and adapt to, in some cases, at worst, assimilate to make sure that we keep ourselves safe.
No, absolutely. Absolutely. Did you have any additional thoughts on that, Glenda?
Yes, one of the things that when she was talking about assimilate and trying to keep oneself safe, the thought that came to my mind is really also trying to beat down stereotypes related to particularly Black women, because I think one of the things that people of color also are managing is the stereotype that people have of them, particularly around feelings of frustration, right? Because one of the things that we know about racism is that it tends to dehumanize an individual. And so when racism dehumanizes an individual, it robs them of their humanity. And part of humanity includes the fact that we have emotions, that we can be angry and frustrated and upset and be tearful and all of those kinds of things. But oftentimes in certain environments, in certain settings, our emotions are not allowed. So it's not okay for me to be upset. It's not okay for me to express frustrations, especially around racial issues and the racial tension or experiences that I'm having, because the person of color may fear, particularly a woman of color, that I'm going to be labeled and painted as an angry Black woman, which even with that label, it's like, but am I not allowed to be angry or upset about this issue? But you can, and you can, people of the dominant culture can be upset. So that's what it does. One of the things that racism does, in addition to what Hazel is saying about sometimes we don't recognize it, sometimes we don't have the energy, but I think sometimes the system does not allow for us to experience and fully engage in our humanity. And that includes feelings of frustration because for fear that we might be labeled and it might be turned and used against us, and particularly in the work environment. So when Hazel's talking about this assimilation, adjustment, and things like what we have to do to survive, it's in response to a system like racism that really robs us of our ability to be able to also express ourselves and express our feelings, emotions, anger, and frustration also in a timely manner.
And it's, as you were saying, expounding on that, a couple of things came to mind that I think is so true. So, we have the system that doesn't allow for us to express our full selves and our humanness, right? And then what happens is, and see this often, when, and I'm going to use, because this recently happened with a Black woman that I know, expressed herself, and addressed something that was egregious from her white counterpart. And in doing so, she just expressed her frustration and her anger around this egregious act where she was overlooked, undermined. Essentially just completely disregarded in the most disrespectful way. And when she expressed herself, she immediately, once that was done, she immediately started to feel shame around the fact that she was angry, that she was frustrated, that she was hurt, And she showed that. And her words was, now I'm going to look like the angry Black woman. And I did not want to come off that way. So now she has to deal with not only the aggression that was thrown at her, but now the shame that comes with her humanity, her humanness, and expressing how she, and being decentered because the person that she addressed began to cry and became the center of the story, right? So there's all of that, and that just is weighty and it's exhausting to the nth degree, right? And so as you were saying that, one of the things that I try when I'm working with clients on racialized trauma or race-based, stressors or what have you, I try to help them change their language a little bit. I've heard clients say, and I've even said this in my lifetime, man, being Black is exhausting. No, being Black is not exhausting. What's exhausting is systemic racism. That's exhausting. What's exhausting is the system that we're a part of that doesn't allow us to live fully into our humanity. That's so as you're saying that, it made me think of.
So that made me think of two things. Number one is I had an example where I was an attending in charge of this high-risk clinic, and I had a female counterpart who helped consult she was a kidney doctor. And she walked in and said, "Who said this patient had a severe headaches. We were worried about a brain tumor, needed a CT scan." And she walked into my clinic with the resident in front of me saying, "Who said she could have this CT scan?" I said she shouldn't have a CT scan. I never turned around and looked at her. I just responded in like manner. I'm the one who said she had a CT scan. What do you want her to do? Sit around and wonder if she has a brain tumor in her head? There's no contraindication to CT scan in pregnancy. In that tone, same tone she walked in and talked to me, and the resident kept hitting me, trying to get me to stop. I said, "No, this doesn't make any sense." And she said, "But Lauren, she's crying." And she was. See, you approach me in this manner, and then I respond in like manner. I didn't curse at you. I didn't yell at you. I don't have four heads. I'm not listening. I'm just saying, no, this is my patient. I'm the one in charge here. I'm the one who ultimately is. But you're crying, and now your issue. So she tried to take it to a higher level. And she said, "Well, I just have concerns about the way she, cares for patients." And my boss said, "Oh, I don't think anybody has any concerns about how Lauren takes care of patients." And so it's sort of, when I was growing up, my mom used to always say, "Excellence that feels it has to be proclaimed admits the very doubt of its existence." So I'll never tell you how good I think I am, but I am confident in what I do because of all those challenges that I have gone through and had to study and be a little bit better than other people. I'm just, and I have faith that God is telling, directs my path. So I study hard and I work hard to do what I think is right. And you're never going to make me feel bad about doing what I think is right. You can teach me and I'm open to learning, but I'm not going to feel bad about it. So I have this confidence about me. And I'm blessed. I've not had, super bad outcomes that I could have affected, and impacted on. So it was nice that I just sat back and he defended me. And then the second, I lost the second component that you were so here's the other thing. I give these lectures on implicit bias. And I have two Black daughters, and there's in healthcare, there are racial disparities, as you saw, and the maternal mortality rate for Black women and infants is horrendous. And I tell people, I am an angry Black woman. And the Bible says, "Be angry and sin not." But I'm angry about this, that it's gone on for decades and we're not making an impact because we won't face the real issue. Racism, as you point out, and all those microaggressions and all those things impact, because it doesn't matter how smart I am, how much money I have, what insurance I have, I'm more at risk because of these things. And until we address the real issue, we won't get to the answer. So, I say to people, and I used to, be concerned but people are going to see you the way they want to see you. They saw me as angry because I responded in like manner to her to say, no, I'm angry that, I'm upset that this woman was walking around for 2 weeks. Should have had the CT scan 2 weeks ago. We need to know, is there a brain tumor there or not? And those kind of things. So I think for me, that was enlightening to be able to say, the Bible says, be angry and sin not. It doesn't say don't be angry. And there's nothing wrong with being angry. I'm angry about this situation. We need to change maternal mortality and racial disparities. And until we're willing to do that. So I think to enlighten people, when I first started to say it to people, particularly Black audiences, I'd say I'm an angry Black woman, and they're like, but there's nothing wrong with that. How you handle it. And love is not easily offended. I'm trying to do it in love, and we're going to make an impact and change this here. So I think that's, for me at least, was life-changing to be able to say, there's nothing wrong with being angry.
And I think one of the things that I think the ways in which that becomes weaponized, right? And I think most people of color are angry about this system, and I love how Hazel talked about this idea of reframing it to really put some of that energy towards the system. But I think you're right. We do walk around with a lot of anger, a lot of frustration daily. And that sometimes has to get managed. But I think the ways in which those labels get weaponized in the workforce, in the educational settings, I think, how we see anger in people of color get dehumanized and misconstrued as if that is associated with danger, or as if it's associated with, for example, children. I often say, if, little Johnny slams his fist on the table, that's seen one way, but if Rashad does it, it's let's make a referral. And so that's the way our anger gets weaponized, that it's somehow there's a threat associated with it. And I think that that's what the system does, is it weaponizes or finds reasons for it's just another reason for categorizing and subjugating individuals within the system. But I think that's the challenge, is the way in which these labels are used against women, especially for advancement or promotion. Well, we're not going to advance her because she's an angry woman, or or that when we look at hiring, promotion, and those kinds of things, that always comes up. But we never also look at other ways in which majority individuals are allowed to express tears and frustration, and no one is saying or using or weaponizing that or using that against them in the work environment. So I think, that's another way in which emotions are treated differently for people of color.
I agree. I totally agree. Example after example after example. And one of the things, I used to be in a different state. I was on an attending the first time I graduated to the level of being attending, and sitting in on the resident. This person wasn't confident enough. This person was too confident. This person was too quiet. This person was too loud. All the people of color had something that they just didn't like. And it's variable. It wasn't like always, we just don't like loud, overly confident people. And having been working more intimately with these residents, I knew who was overconfident and more likely to hurt somebody. And it wasn't the people they were talking about. And so, I learned from that, and I'd learned that from before. You have to be who you are. Some people are quiet, some people are soft-spoken, some people are loud. I'm a little bit of both, depending on the situation, what it needs to be. So, but you need to do what is you, and be confident in that, and not try to change to be somebody else, because then people who don't like you aren't going to like you. Anyway, so you just do the best you can.
Thank you for listening in today. Weren't you inspired, encouraged, and uplifted? We hope so, because we're praying the best for you. Join us again next time for more betterment, because the better you are, the better you are.